Welcome to the Nutrition Research Update from the Renaissante Institute of Integrative Medicine. Hi, I'm Dr. James Machino. One of the questions that I get often is, what supplements should I take to help manage my diabetes and prevent diabetic complications? And it's a very important question. Now, in addition to prudent diet and appropriate medications, it's important for patients that have diabetes to know that there are certain supplements that offer very key benefits in diabetic management that are often overlooked in medical management. So how can certain supplements help? Well, some supplements can help to actually improve blood sugar regulation. That's vital for a diabetic. Also, other supplements can help to keep cholesterol and triglycerides in a more ideal range. So, diabetics often run into cardiovascular problems with heart disease, kidney disease. The small blood vessels behind the eye clog up with cholesterol. That leads to macular degeneration. So, using supplements that can help to keep cholesterol and triglycerides down helps to prevent those problems from happening. We'll get into that in just a moment. Other supplements also help to improve blood circulation. So when you do that, you reduce risk of heart disease and, of course, macular degeneration. And, diabetics have a greater likelihood of having Alzheimer's and dementia, but become vascular dementia. So you actually improve blood flow to the brain. That's an important consideration. And of course, blood flow to the back of the eye to prevent macular degeneration. So improved circulation is something that diabetics have to try to focus on as much as they can. They also need to prevent cataracts. It's one of the things that happens in diabetes is cataracts form more easily. Certain supplements can help to reduce the likelihood of that happening. And also certain supplements can help you burn body fat. If you stay really lean and keep your body fat down, then there's going to be a lower insulin need. Your blood sugar is going to be regulated more effectively without that insulin and blood sugar resistance that occurs when your body fat's too high. So how do the supplements actually work? Well, the supplements that help to improve blood sugar regulation include, first of all, the mineral chromium. So I recommend 200 to 400 micrograms of chromium a day because that's been shown to help improve insulin sensitivity. So the body doesn't have to use as much insulin after a meal to clear blood sugar from the bloodstream, and your blood sugar comes down without needing a huge insulin surge. So these receptors work better on the cell surface when chromium attaches to them. Also, the right dose of vitamin E and vitamin C has been shown to improve insulin sensitivity as well. The insulin receptors work better with vitamin E and vitamin C. And vitamin E and vitamin C are also antioxidants that protect the back of the eye from macular degeneration and are associated with preventing cataract formation in the front of the eye, in the lens of the eye. And there's some evidence that high enough vitamin E and C supplementation may help reduce the likelihood of developing Alzheimer's and dementia down the road. So it has this sort of multi-purpose effect in a diabetic patient to give them the vitamin C and vitamin E they need. How much should they take? Studies would suggest about 400 IUs of vitamin E and 1,000 milligrams of vitamin C broken up into 500 milligrams twice a day. There are supplements that also lower cholesterol and triglycerides. So, diabetics tend to not only have high blood sugar, they tend to have higher cholesterol and triglyceride levels as well. That clogs up blood vessels. That leads to vascular complications, kidney disease, heart disease, macular degeneration. Diabetics go blind for that reason. The supplements gum google and artichoke leaf extract have proven cholesterol and triglyceride lowering effects. So gum google is this resin from the mucal myrrh tree in India. They use it to lower cholesterol. There's amazing clinical studies on it. But it clears the bad cholesterol out of the bloodstream quite effectively. Artichoke leaf extract helps to flush cholesterol through the bile duct into the intestinal tract, and so it leaves the body more efficiently with each bowel movement. And so as you're clearing that cholesterol from the bloodstream, the liver opens its doors and clears more of the bad cholesterol on an ongoing basis with the help of gum google and artichoke leaf extract. Together they can lower cholesterol by 25 to 30%, and they've also been shown to lower triglycerides by up to 30% as well. So a diabetic, we know for a fact a diabetic has to have an LDL cholesterol, that's the bad cholesterol, at 1.8 millimoles per liter or less, which is about 69 milligrams per deciliter, in order to prevent kidney disease that would lead to kidney failure and kidney dialysis and kidney transplant. And also to prevent heart disease and stroke, you have to have an LDL cholesterol down at 1.8 or less. Gum google and artichoke leaf extract can help you get there And many patients who are diabetics are already on statin drugs to keep their cholesterol down. The truth is, you can use gum google and artichoke leaf extract with statin drugs to keep the cholesterol down, to get it into that ideal range. And possibly your doctor will allow you to lower your dose of statin drugs, because the statin drugs, as you know, can cause liver damage and kidney damage and some other problems. So it helps you use, in some cases, a lower dose of statin drugs. There are supplements that help to protect the eye from going blind. Vitamin C and vitamin E, because they block free radical damage, and also they reduce macular degeneration, as we talked about. And of course, keeping your cholesterol down with gum google and artichoke leaf extract allows better blood flow to the back of the eye. That helps to prevent macular degeneration. But here's something else to know. The supplements quercetin and vitamin C block the conversion of blood sugar into sorbitol in the lens of the eye. A lot of cataracts form in diabetics because their blood sugar is high, and there's an enzyme that converts that blood sugar into sorbitol, which forms sort of this opacity in the lens of the eye. Quercetin blocks that enzyme. Vitamin C has been shown to block that enzyme. The enzyme is known as aldose reductase, if you're keeping score. But quercetin becomes an additional supplement to consider, 500 milligrams twice a day. And then supplements that improve circulation generally are essential fatty acids. I like the combination of fish oil with flaxseed oil and borage seed oil, all in one capsule. Taking 3 capsules a day, to me, is ideal. It also has anti-inflammatory effects. It slows down the rate at which cells divide, so there's a lower risk of cancer. You might want to know this, that diabetics have a higher risk of cancer because the high insulin level causes cells to divide too quickly. They make more genetic mistakes that lead to cancer. So anything you can do to slow down the rate of cell division reduces your risk of cancer. So, managing your blood sugar better, getting your insulin down through diet, drugs, and also supplements, but also when you add the right essential fatty acid, fish, flaxseed, and borage seed oil, it slows down the rate of cell division. That's in your best interest. And as I say, it also has anti-inflammatory effects. To get your body fat down, the combination of chromium, which we've already spoken about, with hydroxycitric acid and catechins from decaffeinated green tea, that combination works really well to help your body metabolize fat. The hydroxycitric acid from a fruit called the Garcinia cambogia fruit blocks the conversion of carbohydrates into fat in the liver and acts sort of as a natural appetite suppressant. And the catechins from decaffeinated green tea turn on your brown fat, which gets your body to burn calories even when you're just not even active. So you burn more fat calories and give it off to the environment as heat. As your body fat comes down, that improves insulin sensitivity. That brings your blood sugar down more naturally. And with that, very often, with the right exercise and diet, your blood sugar is going down, your blood pressure is going down, and you see also a drop in triglycerides and cholesterol as well. So all these things work together. So it may sound a bit confusing, but if you click on the link below, you'll see my summary sheet on supplements that should be taken by diabetic patients to help improve their overall management in conjunction with prudent diet and appropriate medication. Thanks so much for watching.